Excellent. Thank you. And I'm going to go ahead and show my screen if all decides to work well. And as we know, sometimes it does. uh, there we go. Let's see here. Well, I say I'm going to share. Um,
Did your computer say no?
my computer's saying, let's be crabby today, much like yours is. Let's see if I can do it this way. No. All right. One more time. Darren, I might have to, I did send it to you. I might have to have you do it because I'm not
Okay.
look this morning. Here we go. Now it finally showed up at the on the screen as an option.
Well, thanks so many of everybody coming back for day two. This looks like a great group who many attended day one. So thanks for the return.
Yay. All right. Are you guys seeing my screen?
Yeah, chart review form.
Okay. Which is not the start. So how about I go back up to that? Pardon me. I apologize for it taking me a minute, but it is taking me a minute. All right. And we're off and running.
We are now.
Day two,
Woohoo!
Fidelity reviewer training. Yeah, definitely. Woo!
Everybody survived day one.
Woo! So, we'll do a little bit of a review. We'll probably don't need to do introductions again since we've done that. And if folks need more information about us, feel free to ask. As always, within our trainings, we like them to be interactive. And so you can either unmute or put in the chat. And I will say, Darren, that you get to be the chat monitoring guy, which you do very well. Darren's great with putting links in the chat and comments in the chat. And so thank you for doing that, Darren.
Yeah, no
All
worries.
right. What's that?
No worries.
No worries. I appreciate that. We make a good team. And I would make a good slide shower if, oh, I could actually get it to move. There it went. All right. So here's part of our review. Um, we talked last time about preparation and components of preparation and review activities and notifications and just a variety of those kinds of things. And I'm curious to know, does anybody between Monday when we did the part one and today, did you have any thoughts, any questions that maybe you didn't ask last time that you would like to kind of at least put on a parking lot now so we can make sure to address it as we go? Anybody have questions that didn't get answered?
Or any new questions after marinating in IPS information overload?
Marinating, I like it. Evidently, we're just big pieces of meat too, huh?
I know, it's just like it's a good theme.
I don't know. I don't know about that.
Oh.
All right. I'm going to move on to the next one. I think we did mention that fidelity is fidelity, and when you perform services to the highest fidelity, you're likely to get better outcomes. That's been proven over and over and over again. But we also talked a little bit about the fact that some of the fidelity items might not work within the structure of your agency. And I think the example I gave of that last time was caseload size. For highest fidelity, a caseload in supported employment is 20 or fewer. In supportive housing, it's 15 or fewer. So there's, this is definitely how, or employment related, I should say. So 20 or fewer. But the agency that I worked for decided that monetarily a caseload of 25 was going to bring in the income that we needed to really keep the doors open. Excuse me. And we would want you to keep the doors open. So there are going to be most definitely Fidelity items that you and your agency look at and say, can't do that to a 5, might do it to a 4, but can't perform it to the highest level of fidelity, and that's okay. Um, one of the things that I've seen time and again in fidelity reviews is that sometimes leadership knows little or nothing about supported employment. And so some of this kinds of decisions need your input to end up being a decision that benefits the program and the agency. Because I have seen, so many CEOs and folks at a leadership level that if you ask them, can you tell me about supported employment or fidelity or both, they're hard pressed to come up with any kind of answers. And so keep in mind that one of these challenges with fidelity is the fact that there are leadership team members in some agencies that really know nothing about supported employment. So you get to teach them. And that's actually, in my mind, um, an important role of a supervisor in an agency providing IPS services.
Well, I think that's an important anchor. That's part of one of the principles that we'll be looking at today is actually having the SE supervisor meet with the CEO twice a month. The nice thing about the model is for the agency to adopt evidence-based practices, there's some things I really needed support from my leadership, and that was one. So that was a great time that I could educate about what IPS is, because I've gone to interviews and maybe somebody isn't able to show up, so somebody else fills in for somebody, and they're pretty much blindsided by the process. So I really encourage folks, if you can start that conversation with leadership early about IPS and FCS, it really helps in changing the culture of the organization early on.
Yeah. One of the things that the agency that I worked for, and I was very thankful, um, they gave me a piece of orientation with all new staff. Didn't
That's
matter if
awesome.
it was the janitor, the front desk folks, case managers, therapists, you name it. I got to talk about IPS and FCS in orientation. What that resulted in was a lot more referrals, was a lot better understanding, was a lot better collaboration, especially from those new staff. The new case managers and therapists would start referring just right off the bat. So it made a huge amount of difference to kind of catch folks when they were new to the agency and give them that information in order to help them fully acclimate with the whole idea of IPS and FCS.
Interesting how new staff can have that zero exclusion right there at their fingertips, huh, Don?
Yep, yep. It actually was a wonderful thing. I think it was one of the most powerful things that our agency did in order to make sure that IPS was part of things. All right. And Darren, you said this is an active link, huh? Do you want
We're
me
gonna
to
find
look
out
at
how well
that?
Darren's editing skills are. Yes.
So I think is this the only video you put in this time? We
There
love
might be one at the very end, but I think
we
there's only
love
the
Galen and Sandy so much. Let's just see if we can make it work.
IPS fan club here.
Yeah. And I know, and I didn't do anything with audio, so I'm going to need that anyway. All right.
Hello and welcome. I'm Galen Smith.
And I'm Sandy Reese.
Can you
And we'll be
hear
your
the
host and your Fidelity Review
video,
guides,
the audio?
demonstrating some of the techniques
You
for
don't see the
conducting
video
career
though.
employment Fidelity reviews.
The interviews and scenes you'll see in this video are based on the experience of
You said you can't see the video, Darren?
Correct. I just hear the audio.
Okay. All right.
I think when you're doing your share screen, it's only showing us your PowerPoint. And so when it opened the video in a different window, it's not showing us that. You got to,
Okay.
and there's a different share screen that lets you share whatever's on your screen.
Okay.
But I'd have to see your screen to talk you through it. or differently.
Apologize. I'm obviously not as adept as Darren at this piece of things. Darren, do you want to see if you can share from your screen and I'll quit sharing from mine?
Yeah, let me pull the PowerPoint from the email.
Yeah. My fault that we're fiddling around a little bit here. Sorry about that.
Oh, where's my share button? And let me go to make sure we have audio. Oh, where?
Thank you for doing that, Darren.
Share computer sound. There's Galen.
Is indeed.
How's the sound?
Good. Well done.
Hello and welcome. I'm Galen Smith,
And I'm Sandy Reese.
and we'll be your host and your Fidelity Review guides, demonstrating some of the techniques for conducting supported employment Fidelity reviews.
The interviews and scenes you'll see in this video are based on the experiences of reviewers like us, who have conducted Fidelity visits with many agencies across the country. These demonstrations have been created based on those experiences. The regular use of Fidelity reviews helps an agency to understand how closely they are following an evidence-based practice such as supported employment.
Some people have concerns about the value of Fidelity reports. We want to be clear that Fidelity reviews are important because good Fidelity means better outcomes for the people who are using the services. For example, in supported employment, we know that more people will become employed when an agency closely follows Fidelity guidelines.
Before we get underway, we want to express our gratitude to our partners from Johnson & Johnson Corporate Contributions for their support of the Johnson & Johnson Dartmouth Community Mental Health Program and for making this multimedia kit possible. In this national program, we have worked with scores of mental health and vocational rehabilitation agencies to establish and develop high-fidelity supported employment programs.
We're often asked about which people should conduct Fidelity reviews for agencies. Based on our experiences, we recommend that agencies not conduct their own Fidelity reviews because it's difficult to be objective about services in your own agency.
We recommend that Fidelity reviews be conducted by people who have a solid working knowledge of evidence-based supported employment and who have been trained to conduct reviews and write Fidelity reports. We highly recommend that people be provided the opportunity to observe several Fidelity visits with trained and experienced supported employment Fidelity reviewers as a part of their training.
We recommend that you actively use the materials in the Fidelity kit as you watch and learn with this DVD. You have a supported employment kit that contains the 2008 Fidelity Scale, a scoring sheet, the Fidelity Review Manual, a sample Fidelity visit schedule, and a sample supported employment Fidelity report from a fictional agency.
If you're not familiar with the updated 2008 Supported Employment Fidelity Scale, please pause the video and carefully review each of the items on the scale.
The 2008 scale was revised to make sure it's based on the most current research evidence for supported employment services. You'll notice that for each Fidelity item, there is a 1 to 5 rating scale. This scale describes how well each item is implemented by the agency. A score of 1 is the lowest level of implementation, and a score of 5 indicates that an item is fully implemented. In your Fidelity kit, you'll also find a supported employment Fidelity Review Manual. This manual describes the review process, provides tips for asking questions, and includes a sample Fidelity review schedule. We strongly encourage you to spend time reading this manual and the attached sample Fidelity report.
During a Fidelity review visit, it's important for reviewers to gather as much information as possible from multiple sources in order to develop a correct score for each item. For example, gathering information for the Fidelity item, community-based services, during a Fidelity visit, a reviewer might ask an employment specialist to go over her schedule for the past week using her datebook and describe where each service occurred. A reviewer may also ask clients where they met with their employment specialist, and a reviewer may look for location codes on progress notes and client records. Using multiple sources of information helps reviewers to be accurate as possible in scoring Fidelity items.
This video is presented in 10 sections. After this introduction, you'll have the chance to see some critical components of a Fidelity review, including an executive director interview, a supported employment unit meeting, a client group interview, a supported employment supervisor interview, a mental health treatment team meeting, a job development observation, client record review discussion, consensus scoring, and finally a wrap-up. During this video, we will not have time to show an entire Fidelity review, but we hope that the demonstrations give you a sense of how a Fidelity visit is conducted.
Fidelity reviews are most useful when they are understood as a part of a quality improvement process. Fidelity reviews provide opportunities to highlight program strengths and areas for improvement. For well-established programs, Fidelity reviews are an important way to prevent the agency from drifting away from the critical components.
In planning for a supported employment Fidelity review, it's important to allow enough time at the agency to develop a good understanding of the program. The amount of time needed varies depending on characteristics of the agency, such as the number of clients, the number of supported employment specialists, and the number of different sites where supported employment services are provided.
In general, we recommend that a good Fidelity review should take anywhere between 1.5 to 2 full days. Of course, this depends on good preparation before the visit.
Before the first day of the Fidelity review, it is important to accomplish some key tasks. One person from the agency should be responsible for setting up the visit schedule several weeks in advance. The Fidelity reviewer should provide a list of activities to schedule at the agency. The reviewers should approve the final schedule a week in advance to ensure that it includes the listed activities.
It is important to make any arrangements regarding client confidentiality or business associates agreements with the agency in advance. Reviewers should frequently remind people that while they may take notes, they do not record people's names or personal information in the Fidelity summary report. We recommend that employment specialists and case managers have the opportunity to be interviewed without their supervisors present in order to promote the open exchange of information. Likewise, we recommend that clients be provided the opportunity to be interviewed without agency staff present. While planning for the Fidelity visit, the agency should assure that there's adequate office space for interviewing people and reviewing records.
For more information about developing a visit schedule, please refer to the Fidelity Review Manual and the Sample Visit Schedule. Reviewers should have a plan for sending the completed Fidelity summary to the agency within a couple of weeks after the visit.
It is useful to establish a clear and common understanding of the purpose and process for the Fidelity review with both the agency director and the supported employment team leader before the Fidelity visit.
Sometimes, agency directors and supported employment team leaders want to know who will receive the report. We recommend that a clear plan for this be developed in advance. So, let's get started with a fictional agency we are calling Great Lakes Mental Health Center. We'll see you in the next section.
It's interesting to me to hear Johnson & Johnson and the fact that the Johnson & Johnson Corporation funded a lot of like these videos, and the Dartmouth Center, which is where the IPS was originally developed, and that kind of thing. Washington, back when I started in this job, or maybe a little before that, 8 or so years ago, was a Johnson & Johnson state. We got some funding to get IPS started. So I have to say I have a lot of admiration for the folks at the Johnson & Johnson Corporation because they were willing to fund to kind of get it started.
Absolutely. I just want to share, I did put quite a few documents in the chat to review. Some of the ones that were listed during the video. And if you can find the Fidelity scale one, because we'll be talking about that throughout the day today. So it'd be good to pop that one open. Hopefully you have two screens or can share screen to look at that information.
Darren, I missed finding a typo when I was looking at the
Darn it.
Alyssa, you're hired. You can be our PowerPoint editor. Appreciate the input.
It's good support from our team.
Indeed, indeed. We'll take all the support we can get. Trust me.
I heard it.
So we talked a little bit about the Fidelity scale yesterday. We're going to go through in a little greater detail today, because we're also going to look at some things in regards to sort of testing you about, here's the scenario, what do you think? Does it fit Fidelity? How would you score it? That kind of thing. So we're going to take a look at the Fidelity scale and go through it in kind of, medium detail, if you will, to prepare you for those kinds of exercises. Darren, you said that one's an active link. Are you able to pull that one up too, or it's one of the links that Darren also put in the Fidelity scale is one of the links that Darren put in the chat box. Here's what it looks like.
Am I still sharing my screen?
You're doing, yep, we've got it.
Okay, I just don't see the bar around it, so it says I am.
Yeah.
Okay.
No, I noticed that too. Normally you get the bar, but not today. Evidently it's tired. So am I. So we have talked a little bit about the fact that caseload size of 20 or fewer. But I'm going to take a minute to just talk about the Fidelity scale and kind of what you see there. So it says staffing. There are going to be 3 items in the staffing category. There's different categories, and we'll talk about that later. But so you see staffing, you see kind of the definition of caseload size. And then in the middle, you see MIS, DOC, INT. That's documentation review, it's interviews, and it's what's MIS, Darren? My mind's gone blank.
I want to say that's information systems.
There we go. You're exactly right. Each of the 25 principles has scoring under the column that says anchor. Sometimes it's a percentage. Sometimes, and you see the first one is just plain numbers. The second one, you see that it is percentage. Sometimes it's separate items where it'll say things like when it talks about teams, the IPS teams, that they should be in close proximity to their referral sources, the folks referring to them, is one of the anchored items that'll show up in that one. But there are 4 other items that you get a score based on the number of items that are in fact found to be the case. So things differ a little bit in regards to scoring each one, but you have the criteria for scoring right there. So there you see employment services staff provide only employment services. Once again, the management information system, documentation, interview. See, Darren, it was a test. I remember what it was.
Yay.
And you'll see that they allow just a teeny bit of leeway that an employment specialist can do just a minimal number of things outside of the scope of employment. Now, let me tell you, that differs from what you can bill WellPoint for when you're a provider. WellPoint has a list of services, pre-employment and employment sustaining, that are billable. Just because this Fidelity item shows that you can do 4% of the time something other than specifically employment doesn't mean that that can also be billed to WellPoint. So understand there's a distinction between the two. And just recognize that when you're talking about billing items, go with what WellPoint has published in regards to pre-employment and employment sustaining activities for billing.
I
What
think
we,
one of the challenges too for some of the principles we're going to look at, I know there's a lot of new agencies starting out. They might just have one staff split into,
yeah,
two duties. This is where it kind of gets difficult to sense without, diving into an interview and looking at some of the data and looking at people's calendars to kind of see where they're at in terms of actually how much time, they're doing one role versus another. And I know everybody in social services is super busy, a lot of high productivity, demands, individual time, with your participants. But this is really focusing on the IPS, principles. And sometimes, we have to explain a little bit during fidelity reviews that yes, we understand the environment we're in with FCS and expanding services, but we're also looking at some of these, specific criteria here for the IPS fidelity scale to see how the program is doing in terms of matching some of these goals.
sure. And I will tell you from personal experience, the state of Washington had a different Medicaid waiver once upon a time. It was called the 1915B waiver. It allowed us to bill for supported employment activities like the 1115 does. The legislature did away with it because it wasn't statewide. So the agency that I worked for they didn't get rid of the department. A lot of agencies did.
Oh,
But
wow.
the agency that I worked for ended up having us be case managers with a supported employment specialty. What I will tell you, and what I've seen ever since when I've done fidelity reviews, is that if a person does housing and employment concurrently, if the same staff does them, um, typically housing gets the bulk of the services and employment gets very few. Why do you suppose that is? Anybody have any thoughts? So I want you to think about the person that you're working with in housing that has a neighbor that calls the police on them. Here I see somebody has responded. Priority to be housed. To some degree, yes. Interestingly enough, when I had a caseload of folks and was doing that, some people wanted to be employed before they wanted to be housed. And I know that's hard to wrap one's head around, but I'm telling you, it's a fact. Not everybody that you're going to receive a referral of is going to say that they want housing first and employment second. Sometimes it's the other way around. And it is the choice of the person that's what we go with. I see Alyssa says more people need housing in comparison to work. Also depends on the client, the benefits they have, probation requirements to be housed. Yeah. So there are a huge variety of things that go into this. What I'll tell you is that when I've done fidelity reviews, I actually count for, say, a month, a person that's getting housing and employment, and I'll count the number of progress notes or encounters for housing versus employment. I have yet to see one where they were equal. And if you have somebody on your caseload that has asked for housing and employment, it should be 50-50. I've yet to see an agency be able to do that. Not one, not ever. And so if the person has asked for both, and if they're getting 3/4 housing, 1/4 employment, in my mind, that's not okay. I don't know if you agree or not, but if they've asked for employment, they should get equal opportunity to receive those services. So if you're an agency that has to start out with a staff that does both, I'm going to encourage you to really put some thought and really be intentional about how can you do the services in equal measures. Next page, please, Darren. Oh, are we not going to go through the rest of the fidelity scale?
Oh, we can. Let me pull that back up.
Sorry about that. I was unclear.
Uh, where was it living? There it is.
All right. So vocational generalists. And I do see Jamie said agreed. I've always thought that a staff couldn't provide both. Only recently learned that they could provide both. Well, both permanent supportive housing and supported employment Fidelity indicate that it's not preferable to provide both in the same person. And you'll see as we go through some of these other principal items, and we'll bring up where here's another example of why it works better not to do it that way. I see Mindy says it depends on responsiveness too, though. I find that a lot of clients struggle to maintain contact with multiple support staff. And Tiana says, I was under the impression that SC cannot be a dual role with housing. Let me explain that Fidelity is encouraged. The meeting Fidelity principles is encouraged because it increases your outcomes. There's nothing in Fidelity that says you have to do this or that. It's a recommendation. And for the best outcomes, you hope to provide the services to, kind of a 5 kind of a level, but there's nothing in it that says you have to do. Now, having said that, we have discussed, and with WellPoint, the idea of starting to publish agencies' Fidelity scores as they have Fidelity reviews, because people are going to want to receive services from the folks that do the best job. We've discussed the idea of, publishing the scores, or at least Met Fidelity, because it can help an agency to get grant funding. If they're applying for a grant and they can show that they've been found to meet Fidelity or provide services at a high quality, that will help agencies to get grants and additional funding. So there's a lot of reasons for doing it. There's been no decision made yet in regards to how it's going to look. But I will say that the WellPoint contract hasn't had in it previously that agencies have to participate in some fashion in Fidelity. The upcoming contracts are going to have that. It is going to be an expectation. The huge number of agencies that exist make it impossible to do them all at once or all within a year or whatever. So there's going to be some system for deciding who gets the Fidelity reviews first, and then adding to that as we go. But part of that participation will also be potentially sending staff to be on a Fidelity review team, or participating in the learning collaborative and required trainings, or just a wide variety of things that it could be in that first year or two that it shows up in the WellPoint contracts. Just be aware of the fact it's coming. There are things that are working on now. Lander says housing is more needed and clients tend to want housing first, depending upon client needs at the time of services, has been my experience in working with clients I am now. So I'm going to tell you, Lander, I agree with that to some degree. I've done supported employment for 35 years. There have been lots of occasions. I won't say the majority of occasions, but lots of occasions that people have opted to do employment first. And lots of occasions where the agency didn't allow them that choice. They shoved housing on them and didn't even try to address supported employment. Don't fall in that trap. Ask the person, because they are the one that gets to make the choice. Do you want to do housing first? Do you want to do employment first? Do you want to try to do them both at the same time? Tiana says, thanks for clarifying. Jamie says, got a lot more clients interested in employment and going to college. A lot of our unhoused would rather go to college than get housed first. And part of it depends on how we frame it to individuals. Part of it depends on whether we ask at all. Part of it depends on maybe folks have been looking for housing and they're on a waiting list for a housing voucher, and they've been on the list forever. And it doesn't do anything good for their behavioral health and recovery to not have that positive outlet, to have that positive, community involvement, to have, kind of those things that support recovery. And so I think I find with housing that when folks have been put on lists for Section 8 or whatever it might be, and they're waiting for months and months and months and months and nothing happens, it's anxiety producing. Folks become depressed.
Despair.
And despair, absolutely. They lose hope. And so it doesn't make any sense to me that you wouldn't address both at the same time, because I think that going to college or getting a job or things along that line can do, proven to do, that's part of the data, shows that employment and education are a big piece of behavioral health recovery. So
Absolutely.
just please keep these thoughts in mind. Darren and I aren't going to be in your back pocket to see how well you do with it, but for the benefit of the folks being served, please consider these things as you move forward.
Well, one
Um,
thing we're advocates for is that you can combine housing and employment together to kind of provide those wraparound services, or at
yeah.
least having that conversation with some of the folks you're working with housing. Have you thought about, are you interested? How do you spend your day? Would you like some more structured time? Because I've gone to some agencies and it's like, Darren, we're housing first. This is what we're doing. It's just like, that's great. Housing is needed. But do you do any follow-up conversations, just like Jamie said? Maybe there's some training, maybe there's school, maybe there's some goals they've always wanted to come back to complete, whether it's college or their A degree, or some kind of training that you can incorporate some of those ideas, because we're always kind of laying that foundation for the future. And hopefully the future just isn't that, okay, now you're housed, see you later. Everything will be fine when we know that's not really the case.
Jamie says, is it allowed to have a housing service and employment service in the same day, or must it be separate days? I know for another SUD service, we cannot bill twice in one day. Um, and I saw that Tiana said something about WellPoint and what they had to say about a question that she asked. What I'm going to say from my experience in providing services, and I'm going to go to the behavioral health agency that I worked with. As long as they are two distinct services billed in a distinct manner. As an example, it was very common for a therapist to provide a service, then a case manager to provide a separate service billed separately, and then maybe an employment person to provide a third service. Because if the person was, kind of in the office for one of the services, we'd tack on to that, maybe take him and go out from there and do the service that we were going to do. So that's been my experience. Medicaid doesn't say, no, you can't have two services in a day, but they need to be billed distinctly. Well,
Hmm.
and then we also had times when, say, I'd sit in with a therapist or a case manager for my supported employment part of things, and we'd do a collaborative session with the person we were working with. In that case, the therapist or whoever it was, and I would sit down and say, okay, you did your piece from 10 to 10:30. I'm documenting my piece from 10:30 to 11. There could be no overlap. And we were in the same meeting and did the meeting together. Um, and we did it that way so that the clinicians, the therapist and the supported employment person both got credit for their time, if you will, and could document what it was that was going on with the person. So
That's a great example, Don. Because yeah, I used to do the same. It was like a collateral, but I wouldn't bill for it, but I could still document in an information note if I needed.
sure.
This is the real beauty of the SE side for fee for service. 15-minute increments, you could have somebody do part of it and then have that separate timestamp and those services, after that. So I think it's really good strategy to do services both in the same day. If it's available, depending on how your structure is and what you can do, but definitely you
Yeah.
can.
Lots of factors involved, but it is possible. Yeah. Lander says, I do encourage clients to seeking employment in order to get housing. Without employment, it's difficult to get housing without income. Yeah, absolute truth.
It's
And
true.
hopefully, and I say this knowing that fair housing standards at this point in time are ridiculous. I think for Spokane, a one bedroom fair housing is $1,400 a month. That doesn't mean that's what they're charging for rent. They charge higher than that, for heaven's sakes. So I'm sad to say sometimes people have to have two jobs or um, still have to have subsidies or whatever. But at the very least, they get a little more choice in what opportunities they have available to them if they're working. And in some cases, they can pay for their housing and not have to jump through all the hoops that go along with housing vouchers and things along that line. And the worry of, is it going to go away because there's budget cuts at some point? Or so, I appreciate that thought process, Lander, just an awful lot. Um, in my mind, whatever we can do to get people away from governmental subsidies, the better off they're going to be. Um, Especially in this day and age where things are so frightening and up in the air, you know?
Tumultuous. Don't
Oh
know what the
God.
outcome's going to be, but I
Yeah.
agree. It's dependence versus more independence and
Yeah.
autonomy.
Yeah, absolutely.
Great
Frightening
discussion
times.
in the chat. Thanks, everybody.
It is. Thank you for participating. Um, Vocational generalist is just kind of a way of saying that the person that's providing employment services provides all of the employment services. So, the assessment or career profile and the job search and job coaching and all of that kind of thing. When Darren and I went through IPS training, one of the things that the IPS Employment Center encourages is consider what kind of the bottom line is for this principle. What's the underlying idea? And in this one, the underlying idea is the person gets to work with one person. They don't have to retell their story over and over again, which can be re-traumatizing. And the staff person gets to know the job seeker better if they're the one that does everything. So that's kind of the intent there and that's kind of the way you should look at all the principles is what's the underlying intent. Integration of rehabilitation with mental health treatment through team assignment. IPS was written originally for people with serious mental illness. That was the population that was going to be served. In the majority of IPS states, or maybe all of them except for us, what you see is that the agencies providing the services are behavioral health agencies, which makes it a little easier for folks. And I mentioned that on Monday. The agency that I worked for had a therapy team and a case manager team and bed management and on and on and on. And we would have all staff meetings periodically. We would have unit meetings, and then we would have kind of collaborative unit meetings so that we could collaborate on services for people and talk about what's going on with other individuals and maybe people up and coming and, do they need SE services? See, Ruben says, great Q&A for being able to provide services for both housing and employment in the same day. Cool, good. And so this is just one of those examples of, the program was originally written for behavioral health agencies, is being used even at the IPS Employment Center level I mentioned, I think the other day, they talked at one of the yearly meetings about doing a study with veterans who were paraplegic, work first folks.
TANF.
TANF, absolutely. Substance use disorder, opioid use disorder. So this scale is being used for others, which means the integration with the team member contact and assignment kind of a thing is somewhat harder to do. It's harder to do when you don't have the therapist that's working with a person in your agency and you have to try and reach out to them. But the intent is if you have, say, an agency, maybe Department of Corrections, providing you with most of your referrals, then you should be meeting with Department of Corrections in order to maintain contact about what's going on with folks. That's kind of the underlying intent there. So you continue going on with the scale, Darren?
Yeah, I just put a comment in, but I had something to add.
Okay. That's okay. I'll actually shut up and take a breath for a minute.
Take a drink of coffee.
I have now moved to it's called Bubbler Antioxidant Sparkling Water.
Wait, that sounds fancy.
I hope so. It's
I
got
just
some
want to.
caffeine and vitamins, so there we go.
Whoa, that's a plus. I like it now.
Go. Absolutely.
This
There's
is
my
kind of
yeah.
also an organization where when I'm a Fidelity reviewer, there's a little bit of rub with, FCS and IPS, because as Don said, we're looking at a lot of different organizations and agencies, clubhouses, social service, peer-run organizations who really don't match up with the base model that this is based on, the brick and mortar behavioral health, where you might have therapists and case managers, medical providers. So there is a little bit more work to be done in terms of alignment for some of these anchors, and that's okay. But we
Yeah.
do want folks to always thinking about, are there other people that you're coordinating with in the community, and are you documenting it, in the chart so that we have that record of collaboration. A lot of times, organizations give us the data, they give us, the participant list. But for high fidelity, you really need to see where those referrals come from. Are they coming, from DVR? Are they coming from ALTSA? Who, a clubhouse, down the road, or maybe a shelter is doing a lot of referrals. To really think about when you're organizing data and you're using the participant tracker is to have that column to see where they're coming from. I used to do this when we trained at the program I was in because we'd have the SUD team, we had the domestic violence team, child and family pack. We had all these different teams, and my staff, I didn't have enough staff to align everybody. So I had to be more specific and really limit 2 teams per employment specialist, to meet the high fidelity on the item. So sometimes there's the challenges in how you divide your work and who you're going to choose. I know a lot of providers are working with drug courts. That's a referral source. So as there's small agencies or agencies that are growing, this could be a challenge. And that's okay. I'm not saying we need to just focus on, all the high fidelity, but it's really easy to get adherence to higher fidelity if you just add a little bit more data tracking or how you look at the referral part in the process.
Good point.
This is a
Good point.
core foundation of those collaborations in the community that, IPS is a really strong advocate for.
Well, and I will say, when we talk about underlying principles, you know what one of the ones is here? Not to overwhelm staff.
Yeah.
That's not a bad underlying principle. So, kind of limiting the numbers of meetings and things that employment specialists have to go to.
Staff will appreciate that.
While, you bet, while maintaining that collaboration. So here's one of the ones that I was mentioning where some of them are numbers, some of them are like up to 20 participants. Some are percentages, X percent of the time that you're doing only employment services. This one's one of those ones that has the different items under the anchors, and you count how many of them are there in order to determine how close to fidelity you're providing the services. So integration of rehabilitation with mental health treatment team through frequent team member contact. You can see attends weekly meetings that are collaborative meetings. So with mental health or DOC or TANF or whoever your large referrers having weekly treatment team meetings. I'm not going to say mental health. Interestingly enough, though, if you look at the stats for folks in FCS services, 70% of them have a diagnosable mental health diagnosis. So mental health is prevalent. So weekly meetings, the employment specialist being active in those meetings. Early on in the agency that I worked for, they'd let us attend the therapy meetings, and they'd let us give our little blurb in the beginning, and then they'd excuse us so they could talk about the rest of the stuff. That's against what this is saying. What this is saying is that the employment specialist should be an active member of the team, including making decisions related to, we're talking about Dawn, who's having an increase in symptoms, and maybe the therapist says, I think she should take a break from employment. And as an employment specialist, I'm saying, it's her choice to make. It's Dawn's choice to make. And there's lots of statistics that show that employment helps to reduce mental health symptoms. So, let's ask her and see what she says. That would be the kind of part of decision-making type of a thing that they're talking about. Documentation in the same record, pretty hard to do if you're dealing with an outside entity other than maybe, a letter periodically that they can put in their file and one that they send to you to kind of clarify, here's what's going on with Dawn right at the moment. The office is in close proximity or shared with mental health treatment team members. We were a WorkSource partner. We got some of our referrals from them. We had a desk at WorkSource so that we could be there and WorkSource staff. And I say WorkSource, it's employment security, DVR, the workforce development, the community colleges, DSHS are all part of that WorkSource. So any of us could come to them with somebody who needed some help and support because of their, whether it be behavioral health challenges or whatever, that we could help with those kinds of things. At close proximity, we looked it up in the manual one day. One of the nice things about the manual is it drills down to some real specifics. I see Darren smiling. He knows where I'm going with this. Close
Yep.
proximity means if an agency has a multi-story building, that the employment specialist staff are on the same floor as the teams that are referring to them. So it gets down to that specificity. And then helps the team to think about employment for people who've yet to be referred. Sometimes the answer to a person's current challenges can relate back to the fact that they have too much time on their hands. They're reverting to old negative behaviors because they don't have enough positive activity to engage in. And Darren and I do a training that at conferences that we've entitled "They're Housed, Now What?" Because of the fact that we've heard housing staff say so often that folks can get into trouble when they have too much time on their hands. I can. I bet you can too.
Not me.
Oh, come on, Darren. So that's one of the thoughts there as well.
I just want to add that when I had an office, I was actually in a separate building from the case management therapist, and I really liked it because I had a computer lab, I had a conference room to meet people, I had a lot of extras. So I wasn't really worried about this. I was right next to the building. So, you have to work within the space that you have. I wouldn't,
Yeah.
put a lot of weight on that. But it is important to have those water cooler moments because I notice when in an old agency, an old building, I was right in the mix of everybody. And you do have a lot more conversation with the other clinicians and the other staff. So there's a lot of value to that. The other thing I want to just think about, because I think we saw this in the video the other day where the VR person was part of the meeting and somebody mentioned, well, maybe the person should have dinner with their mom the night before. So sometimes there can be that creative dynamics, of having that conversation. Because if you limit people to times within meetings, it's really hard for that one person to feel part of the team. Two, that they are the subject matter expert in employment. They should be part of the conversation because they can add value and perspective and sometimes some really creative strategies to really decrease some of those negative symptoms or decrease barriers that really might help them in this situation. So that's a part of kind of having that reviewer's perspective when you look at a unit meeting and you're that fly on the wall and just observing to kind of see, is that person interactive all the way through the meeting, or do they just have 5 minutes at the end to say, oh, here's about employment? Because I've seen both. I've been involved with both. It's really hard to feel part of the team when you're just delegated to the last 5 minutes or the first 10 minutes, and then you're asked to go because
Yeah.
we have really important stuff to talk about next. That was a problem. My staff didn't like that either. And it's just
Mhm.
like, yeah, there's some equality in terms of being part of a team. And really, everybody should have that same time commitment and be able to contribute to their observations or ideas when they do some of the consultations and look at some ways to, lower barriers to services.
Definitely. I think one of the things that was very apparent to me, the more that we were in all of those kinds of meetings and active participants, the more that the program was accepted within the agency,
Good point.
up to and including, kind of prior to just my leaving, we would get calls from intake and say, hey, this person can no longer do the work they were able to do. They've got a physical challenge now and they can't continue. And they're really depressed. And we would be the only department working with them in the behavioral health agency because their mental health challenges were directly related to lack of employment or having to lose employment or not being able to continue on with what they were doing before. Refresh my memory because I've had a couple of other meetings with agencies and things this week. Did we talk on Monday about DVR order of selection?
I don't think we did.
Okay, all right. Have you all heard of DVR order of selection?
That's a really good question.
Because maybe. I see Chelsea says yes. Anybody else? Nope.
Nope.
Okay. All right.
Honest answers there.
I like that.
Oh,
Lorraine says, yes, I'm at DVR. So Lorraine, you correct us when we're wrong, but my understanding of order of selection is essentially a waiting list. DVR has levels of disability that they look at related to part of admission criteria. Individuals have to meet certain levels of disability. So disabled, significantly disabled, and most significantly disabled. And then I know within those there's separate criteria as well. So some subsections in some of those. DVR is mandated, federal mandate to get medical information about a person's diagnosis and behavioral information about psychological information about a person's diagnosis to qualify that they have disabilities that would cause them to need the services. And then they have a certain amount of time in order to write a service delivery outcome plan. So the plan, treatment plan kind of a thing. Between all of those things and the amount of time that DVR is allowed, it can take a period of months to get a person into DVR services if they qualify. And if they don't qualify for the like the most significantly disabled at this point in time, they will end up being put in that order of selection or waiting list. I know in years past when I've worked with the agency that I worked for, and we were a division of vocational rehabilitation, community rehabilitation program, which means a vendor that DVR contracted with in order to provide DVR services through that service delivery outcome plan. I know that I had folks on my caseload that I referred to DVR that back then, one gal, it was actually 3 years later, and she got a letter from DVR that said, your case is now open. I'm going to say that's the farthest end of the extreme. And folks may be on the list for some period of time, saying that their service with DVR is not likely to be immediate. And Lorraine, correct me if any of that flies in the face of what you understand. DVR is administered, if you will, not administered, overseen by the RSA, Rehabilitation Services Administration. I just told Darren yesterday I try not to do alphabet soup unless I can't pronounce the word. And RSA is kind of the one that has that deals with the federal regulations and things along that line. DVR has been in and out of order of selection over a period of years, and I know they do their very best to get people in as quickly as they can. They also recently have been referring folks on that list for order of selection to foundational community supports, so that if they are in immediate need of finding employment, they can get some assistance through an FCS agency. So there's collaboration back and forth with DVR on this one. If you think a person needs DVR services, ask them. In my case, I always just ask them anyway as part of the career profile. Have you received DVR services? Are you interested in receiving DVR services? Explained a little bit, and then referred them as they requested. Lorraine says, yes, that's all correct. We look at level of functional information and how many areas they're affected. This decides which category of functional disability they're in, and if they will need to be on the wait list. We currently serving 2 categories, and 2 are on the wait list. Okay, good information, Lorraine. Thanks for the update. Closing all categories is currently being discussed right now. Yeah,
wow.
we live in hard times. Holy crud. Thank you for that update. I appreciate that a great deal.
Yeah, thank you.
And I'll still say, definitely at this point in time, if you feel a person would benefit from DVR services and that is their request, make the referral. Let DVR decide if they end up on on the list or receiving services immediately, because that's not something we can decide anyway.
And I definitely suggest that you help them with that paperwork, because there's a lot of information, a lot of questions. You can be really helpful in gathering some of that as that, pre-assessment relationship building under FCS. The other thing I really encourage people to do, I think I talked about this Monday, is reach out to those supervisors, because I've worked with some agencies who have like a referral list that if they're not going to be eligible for VR, they, here's a referral list to contact for providers in the community. So you could, share your expertise, share maybe some special populations that you work with, or maybe there's something unique that you do in the community to really help the customers to kind of build that relationship, even if you're not, as Don said, a community rehab provider contractor with DVR, you could still be the community support for folks. So it's always great to reach out and, harden that relationship because there's potential referrals for employment or even for employment and housing for folks.
And I see Lorraine also says if someone's on the wait list, they will be in line to be served first when categories open back up. So it isn't a waste of time to schedule an intake or application meeting. Thanks for that too, Lorraine.
Hey, Lorraine, since we have you engaging in chat, if people are referred to VR, are they still eligible to get some benefit planning while they're waiting eligibility?
Oh, good question.
Hey, yeah. So, can you guys hear me okay?
Yeah,
Yes.
thanks for popping on.
Oh, of course. So if someone is referred and they fill out an application and they're found to be eligible, if they are put on the wait list, they can still utilize our benefits planning resources while they're waiting. But they have to be found eligible first.
You have to meet eligibility first?
Mhm.
Okay.
Yeah. Good
That's good to
information.
know.
Thank you.
It's great to get that access from experts because I know not every agency has a certified planner or somebody's familiar with that. So it is that extra benefit to get that specialized services from VR.
And I just really recommend if you have anyone with disability of any sort, just send them to DVR. As a counselor, we're trained to figure out if they're gonna qualify or not, what services we can help them with. So I think if someone is very interested in getting employment, DVR is a good direction to try for.
Yeah, sure, why not?
Awesome. Would you mind sharing which location you're at, Lorraine?
Yeah, I'm in Everett.
Everett. Oh, great. Thanks for joining us today.
Yeah, no problem. And if anybody has any other questions, feel free to email me. I'll put my email in the chat.
Super. Thank you so much.
Well, and having heard that, Lorraine, I see Jamie says, is there a simple way to refer and follow up? I seem to have technical difficulties with DVR.
Yeah, unfortunately, that can be a challenge. I know it depends on the location that you're near, Jamie. I would say if you're having difficulty getting in touch with DVR, just call the main office. You can let me know and I can try to figure out who to put you in touch with.
Well, thank you for that, Lorraine.
Yeah, of course. I think DVR is such a undersold resource, and it is hard because we are limited in funding and staff a lot of times. So DVR is a very long-term process. It's not a quick get a job right away. DVR looks at long-term goals, disability accommodations. So if the person you're working with is just get a job quick, doesn't matter what, DVR is not the best fit. But if you want more of a stability and job planning, DVR is a good direction to go.
Particularly if they need that technical or medical assistance, I found that you have that expertise and the support for that because I see the services dovetailing VR and FCS because FCS can do some of that fast. Maybe I need a job now, but my career goal is to be a CDL driver, or something like that might take a little bit more support to do. So I think there's those opportunities to really dovetail services together.
Yeah, absolutely. That's one of my favorites is if somebody is currently working, but they're wanting to pursue a different job goal. DVR is good at working with that.
Yeah. So I do see Jamie says, do referrals have to stay, DVR referrals have to stay in the county that the individual resides? And then I see you nodding. I've noticed this interesting thing happening with numerous agencies in regards to releases of information. I can have an individual sign an ROI with our agency and send it to DVR and DDA. However, they do not accept the ROI from our agency and say that they must have an ROI from their agency to communicate anything. Jamie, that's a standard operating procedure. I don't know of any agency that will just take yours and not also do theirs. That's sadly HIPAA's a frightening thing. You can get in big trouble if you don't adhere to HIPAA. And so It is just standard operating procedure. You're going to probably find that almost everywhere you go, that both agencies have to have a release of information. Chelsea says, yeah, the different agencies very specific about using their ROIs only. And Jamie says, never seen this happen before. Yeah, no, I've seen it happen all the time. It's a common thing. Oh, bad news is, sorry, you're 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 not going to get those other agencies to risk having to pay tens of thousands of dollars in fines because they didn't do
Millions.
their due diligence. It's you're just going to have to roll with it. And I know that's a pain in the neck. It is a barrier. You're right, but
Hang in there.
understandable. Thanks, Lorraine, for the email address. That is incredibly helpful. Appreciate it much. So vocational unit, there are expectations related to what IPS thinks a vocational unit should be. And if you look at the number 5, it kind of delineates all of the stuff that's the expectation for excuse me, goodness. Evidently that bubbler is good stuff, but I
It's very bubbly.
not bubbly. I want you to notice where it says at least 2 full-time employment specialists. What that means is if you're half-time employment and half-time housing, then your team, and there's only a couple of you, you don't have 2 full-time employment specialists. So you wouldn't be able to, to get a 5 in that case. If all of your staff are half housing, half employment, it depends on the number of staff you have, if you have the equivalent of 2 full-time employment specialists. But even then, it's supposed to be 2 full-time, that the person does only employment, and that there's at least 2 of you to make up a team, along with that
And
team leader.
Don, am I remembering right that the supervisor isn't counted in that?
Yeah, you are remembering correctly, because I think it's under the supervisor. And it's in the manual that it talks about, they encourage the supervisor to have a caseload, but they comment, with all the other duties, no more than 3 people on the caseload. And so that supervisor is never actually going to be a full-time person. Hopefully not. I mean, good grief, with everything else they have to do, geez.
Yeah, that would be tough.
But then they also want to see things like you provide coverage for each other if you're going on vacation or have a medical issue or whatever. You have team meetings in which you share job leads, you staff cases, and you don't do a bunch of administrative stuff. I love in the video where they have the unit meeting, and the gal is talking about, I want to discuss vacation time because I'm ready to go on vacation as we speak. It's like, yeah, that's why she says I'll give you 5 minutes at the end, kind of a deal, is because it's not supposed to be part of the unit meeting. Chelsea says, another note regarding voc rehab: if you're working with Native American Alaskan Native clients, please refer to tribal voc rehab. That's absolutely true in your area. The TVR programs are not on order of selection. Good to know, Chelsea. The other thing is
Wow.
that Division of Services for the Blind has their own VR component as well. And so sometimes, just pardon me, Lorraine, generic DVR is not the right referral for you. It may be more specialized than that. I couldn't come up with a better word. That was not a great one. Sorry about that. All right. So questions up to this point in time in regards to the Fidelity scale and kind of what we're looking at? We got about 15 minutes till lunchtime. Do you think we can get it done in that amount of time, Darren?
Well, you get a few more maybe for this section. It's just the kind of high point how fidelity anchors change, like from like a number we saw a caseload to a percentage employment specialist time to something even more detailed for all the different pieces that come together. And this stuff comes up during consensus scoring is kind of comparing notes to kind of see where the agency falls in. Do they have enough to get to from a 1 to a 2? Do they have those specifics to get to a 3? So this is always a discussion point, especially with small and large agencies on looking at vocational unit size.
Role of supervisor, you can see this is another one of those where there's the different anchors underneath that, count the number that there are, and that's where you come up with the score. And that middle section where it says MIS, INT, DOC, and it says OBS, that's also observation. So when we do a fidelity review, those are the 4 kind of places where we look to come up with answers to scoring for this one. What I see of supervisors these days is they're expected to wear so many hats. I'm surprised that they can continue to function, very honestly. Supervisors and the quality of a program really depends on the quality of the supervision a person gets. So I like that IPS has said they can supervise up to 10 employment specialists. They can have other duties, but they kind of prorate them based on the number of employment specialists versus the number of other things that they've got to do. In the supervisor interview that Galen does, he talks to the person and she says about half of her time goes to a group home and covering when folks call in and that kind of thing, which reduces her legitimate ability to be able to supervise employment specialists. Because part of this, there's the weekly supervision, there's the being the cheerleader to leadership and others, there's mentoring the employment specialists and actually going out with them to do job development and other field mentoring. And then, reviewing the data to see, are the employment specialists doing 6 employer contacts a week? Are they doing, all the documentation and data keeping and progress notes and whatever in the way they're supposed to? And then setting some goals, looking at calendars. Are they spending 65% of their time out in the community? And then setting those goals for program performance at least quarterly for the staff. So the supervisor is such a key, as in any case, to the success of a program. And I think IPS has done a really nice job of giving some real specifics about these are the things that we hope a supervisor would do, and that leadership will not overburden them so that they have the time to do those. So once again, this is also about let's not overwhelm the supervisor as one of the underlying principles. Other
This
things
is one of the principles that I actually, will take from to ask questions with the supervisors just to make sure I can check them off the box.
Yeah.
So there's a few of them that I use that, I'm just definitely relying on this so I can cover it as well as some of the other things. Because as Dawn says, when I was a supervisor, I had a lot on my plate. I'm sure Dawn did as well. And I don't think that has changed in part of the culture. And I think the supervisor really is the anchor for the program because they're the cheerleader, the champion, they're the ones who are going to provide support in the community. It's a full job. So kudos to all of you in that role because your role is super important. And I think it's really the driver to what kind of supported employment program you're going to have at your organization.
Oh, I love zero exclusion. I do. Um, so if you look at the information in the principle, what it's saying is all a person has to do is say, I'm ready to work and I want to work, and that's what makes them able to go to work. And if you think about people that people with whom you've worked, have you ever been surprised by somebody? Have you ever had somebody walk through your door and you thought, wow, I'm not so sure about this one, only to have them succeed, just in an amazing way. And the reverse is true sometimes too. I've had folks come in, new referral to my caseload and thought, wow, this one's going to be easy peasy, only to not have it work. So it's not in us to make the determination. It is in the person to make a determination and to do their very best to make it work through sometimes what seem to be insurmountable kinds of things. But there's lots of proof that shows, please think of your own life. I think of mine. I know what work has done for me. The only time in my life that I've been, and it wasn't unemployed, it was not working, was on maternity leave for a couple of months when my daughter was born. And my depression increased and increased and increased with this wonderful little human being I was getting to spend time with. The fact that I wasn't out and doing my work and interacting with others and getting to do all those things that kind of feed me made a big difference, even given the fact that I had her. And I think back to going back to work and what a boost that was to my mental health, and just life in general. Think about yourself. I think about some of the leaders in the DBHR, Division of Behavioral Health and Recovery, which is the part of HCA that we're in. Many of them share stories about having had substance use disorder and currently recovering from that, or mental health issues, or whatever it might be, and what obtaining employment has meant for them, and not just employment, but in a lot of cases, higher level supervision and that kind of thing has caused their life to turn around. And that's why I love this principle so much. It says if people say they're ready, they're ready. Give them a shot at it. If they don't succeed at the first job that you help them find the next one and see if it's a better fit. Document those lessons learned in regards to this worked well, this did not. And so, that gears, or that leads the job search to some degree in regards to, let's avoid some of the things that didn't work and work towards the ones that do. One of the ways that DVR differs from FCS is that DVR does a lot of really wonderful assessments. I've referred a lot of folks when I was just totally not able to figure out, even though it seemed like they should be able to succeed, they could not. And DVR has helped in a lot of ways to determine, what might be the challenges that weren't so visible that were causing them to have less than success. What IPS says, what individual placement and support says, is if a person says they're ready, give them a shot at it. Try it on. I know some people will say, but if they succeed, isn't that detrimental to their mental health? Maybe. But what it offers is an opportunity for the kind of thing that we all need to do. Every single one of us experiences roadblocks and upsetting situations and traumatic situations. If we learn coping skills during that point in time, we've improved our ability to deal with it the next time it comes, because it will. And that's part of what SE staff does, is if a person loses a job, making it clear to them, this was not the right job for you. And here's the lessons that we've learned. And so now we're armed to go out and do an even better job of finding a job that may be a better fit. And so that ability to help teach some of the coping skills and the reframing of I am not a failure, motivational interviewing, you bet, Jamie. I am not a failure. This was not a good fit. I will find a better fit. I will find the job that fits me and the employer, because it's got to fit both. So this zero exclusion in my mind is about all of that. Other stuff to add, Darren? Yeah, I know I get pretty passionate about this one.
Yeah, you're very passionate. And I'm just saying, you don't hear people really talking about zero exclusion, but you do hear about in barriers, like Don said, somebody who's interested in work, how do they access the program, those type of things. The other thing is, this is great information as you're building a program and you're looking at your PMPs, because that's where some of the formal limitations might come in, or formal barriers. And I know some programs have some of these barriers for safety. I've worked with some shelters, and there might be some rules that they have, about UAs, or being in SUD treatment, or even some behavioral health, anger management, some things like that. Those might be there, but I understand people have to, build a safe community depending on the services they have. But we always like to see, recovery language in terms of other choices or other things that people can do, and how you're really meeting the individual needs for that. Because at the end of the day, like Don said, to kind of really help people, we need to understand, the challenges and use some of the challenges as a learning experience, and kind of take some information. I always encourage folks, like, you have the career profile, but if somebody loses a job and goes to the next, you have those lessons learned. Is there anything we can use a foundation for the next one so that we have a better job match down the road?
Absolutely. So I'm going to say it's 5 minutes to noon. We plan on giving you guys an hour lunch break like we did the other day. Darren, how about we go through this one and then break? Does that
Sounds
sound
good.
okay to you? Okay.
Mhm.
Agency focus on competitive employment. The most successful supported employment programs have support from the leadership on down. And and the bottom back up again, very honestly. So you can see the anchors here that relate to this particular item. That the intake includes questions about interest in employment and not just, so the behavioral health intake that the agency that I worked for had, started out with a question that said, do you want to work? A lot of folks would say no. That's not the kind of questions that they're referring to here. It's, are you working? Do you need some assistance to find work? Are you satisfied with your job? It's not just, do you want to work? Because we know that so many of the people with whom we work will say no because they're afraid of losing their benefits, or they're caving into what they've been told all their lives, which is you're not worth anything. You can't, or whatever else it might be. Maybe their family relies on their SSI to be the family income because the family as a whole is poor. Now, there's just a multitude of reasons why a person might say no. An awful lot of them don't relate to truly not wanting to work. They relate to a whole lot of other stuff. So the wording in that intake makes a difference. Questions about interest in the treatment plans. So once again, that one's everybody's treatment plan. In the agency that I worked for, if you were in therapy, there was a prompting question in the treatment plan that said, have you discussed work with the person? And so every time that treatment plan came up for review, employment was discussed again. And that's kind of what it's referring to here. There should be brochures and postings and flyers in the waiting room so that if people want to self-refer, they can. There should be opportunities for participants in the agency to share their success stories, not just about work, maybe about housing or whatever else it might be. But, we know that the peer movement promotes hope. And this kind of relates back to that promoting hope. If my peer is able to do this or that or whatever else, maybe I can too. And maybe I'm going to ask them about it and how they did it and what kinds of things might make it work for me as well. And then Darren's talked about data. I know Darren gets as passionate about data as I do about zero exclusion. But what is fact is that in order to justify us continuing to give funding, in order for us to be able to share with the legislature and various others, with grant makers, with you name it, we have to have data. We have to have data related to kind of a variety of things, but definitely the ultimate outcome. Did folks get jobs because of FCS IPS? Did folks get housing because of FCS supportive housing? We need to track that kind of thing in order to use it for a variety of reasons, but also to provide hope for leadership and staff within the agency. There are days when I think this work doesn't pay me enough and I'm not going to do it anymore. And then I hear a success story. And it's like, all right, I will. Well, I say that now I'm retiring on the 30th. I've told lots of folks, I haven't died. I haven't lost my passion. I will still be involved in some fashion because I still believe in this every bit as much as I did. I just can't keep up the pace anymore. So, Jamie says, I would love to see how others track their data. I think that's incredibly relevant, Jamie. I'm glad you brought that up. And I would encourage folks, if you have a same thought that you want to share with some of the other folks in this call, how you're tracking data, that put your email in the chat box and make note of that. Darren and I can also show you the tracking form that we've got that we send out to agencies to, kind of manipulate and make your own, but it has a lot of the basics in it, so you don't have to start from scratch as far as a data tracking tool. And I bet you looking at the look on Darren's face, he's looking up to find where the
Yeah, I'm
form
trying to find where I
put it
stashed
in the
it.
chat. Yeah.
That was the look.
See, I recognize that look now.
Yeah.
Jamie says, I have a spreadsheet about 1 million columns long. Would love to see tracking form or any cool forms that anyone, especially Don and Darren, have. Yeah, definitely. Gregory says, would love to see any data tracking practices for SE, and there's your email. So the thing that Darren just put in the chat, I'm sorry, is that tracking form that we share with folks to be maybe a basis. What we've started working on is to make that tracking form address directly the stuff that WellPoint's going to ask for on a yearly basis, so that at the end of the year, you're not scrambling to go back through a year's worth of data to find the stuff. It's already in the form, and you just need to download and put it into the WellPoint form. So anyway, 12:01. How about we take our lunch break and we can look at this tracking form a little bit and then finish this up when we come back, if that works for folks. So 1 o'clock.